Hello, everyone. My name is Judy Sakuza, host of the Mandela Rhodes Foundation podcast. In this episode, I'm honored to be joined by Egyptian medical researcher and Mandela Rhodes Scholar alum, Reem Elsayed. Reem is currently pursuing a DPhil in translational health sciences at Oxford University. Her work examines political, institutional, and social barriers, focusing on rights-based policy approaches and regional comparisons within North Africa, with a particular focus on women's health and system barriers to care across the region. Her leadership reminds us that healthcare is not only a scientific discipline, it is a moral project, one that asks who has access, who is heard, and who is left behind. Reem, welcome. It's such a pleasure to have you with us. How are you coming in today?
Thank you so much, Judy. I'm doing well, and it's such an honor to be here with you today and having these in-depth conversations.
Fantastic. Lovely. Tell us, it's a bit wintry here for us in Cape Town. How are things in Oxford? Is it starting to become spring at least?
Yeah, it's like spring in Oxford is beautiful. Like especially like the roses are everywhere, flowers and the blossoms. And I do have a favorite like spot in the botanical garden where I sit there and just noticing everything, the nature and the beauty.
Awesome, Reem. Well, let's maybe then go back to sort of the origins and formations of your own awareness around the work that you do, you know? Your work is rooted in a deep awareness of inequality in health systems, particularly in North Africa. What first made you aware that access to healthcare was not equal, especially for women?
So I think my awareness started from what I've seen in my community, particularly the systemic injustice affecting women in access to proper education and healthcare. As a child, I accompanied my mother to healthcare facilities, and I've noticed long waiting times, rushed consultations, bureaucratic process that seemed designed somehow to exhaust people before even reaching the medical assistance. So then joining the faculty of pharmacy myself and trained as a pharmacist, and seeing and observing majority of people seeking consultation from a community pharmacist because of the burden that it comes with access to healthcare services and out-of-pocket payments. And volunteering in the US in YWCA and also with YPR in Egypt regarding empowering young people in general about their health and women in particular about sexual and reproductive health. And then becoming pharmacist myself and noticing that the majority of my the patients that come to the pharmacy were women who comes to seek advice about their sexual and reproductive health. And this is just to strike something in my mind, which is this issue, it's a very sensitive, like they used to just seek when everything is quiet, they seek privacy. And then these were matters considered too sensitive, taboos, and to raise openly with male doctor or formal setting might be like an issue. So, and that stayed with me. And it just made me reflect in all the power dynamics and the gender norms that happening in my community, and the power and the silence and the shame that all shapes who gets to access care and in what terms. And that's why I wanted to change from just observing to researching. And that's why I pursued my master's in development studies as a Mandela Rhodes Scholar at the University of Western Cape, where I wanted to unpack all these societal and structural injustices and gender norms and power structures and lots of misconceptions, and see how these systems is being like produced and how we can actually change them.
Amazing. So I'm curious then, sort of linking to what you're saying about that journey and that observation of inequality and really trying to understand from a developmental perspective how, what really informs these systemic issues at their core. Can you share a little bit about what were some of your biggest lessons in your time in residence as a Mandela Rhodes Scholar, and how did those lessons equip you in your leadership journey after?
I think the time in residence for Reem, it was Reem discovering herself for the first time out of the academic space, because what I really enjoyed about the Mandela Rhodes scholarship wasn't only the support that they provided me to pursue my career and the degree, but also they wanted to invest for me as a human being, to reflect, to understand what drives you as a person, what is your purpose, what is your intentions, and how you would be the best version of yourself to be able to be there for other people. So I think it made me think beyond myself. It made me discover my resilience, trust my capabilities, and trust who I am as a person and what I can bring to the table. And I was like being honest. I believe for Mandela Rhodes to believe in me as a person coming from a very small community in Egypt, which was just graduated, but she really wanted to do something bigger than herself, bigger than everything that she's allowed to, it was like a life-changing experience. So being there, having these lessons and bringing these lessons home back to Egypt to change health system and to work in a big health reform in Egypt, which is universal health coverage, and bringing these values and these lessons into the workspace that drives me every single day while I am being in the job. And that's why when things get hard, sometimes I always reflect on these lessons and values and who I am as a person. And I think if I did not go through this journey, I would not have done my job properly as I did.
Beautiful. Thank you for sharing that. So I think it's a nice way to actually then maybe go a little bit deeper on your work, Your research focuses not only on clinical care, but on the social determinants of health. And I guess for us laymen, in a sense, it's the factors that influence who gets treated, right? So please tell us more about your current research at Oxford University. And I think particularly in the context of North Africa, what are some of the most urgent health inequalities facing women today that you are seeking to gain more knowledge and understanding of?
So my current work that I'm currently doing in Oxford is evaluating the integration of access to sexual and reproductive health services into the universal health coverage in Egypt, which is I'm looking, as you said, to the different determinants of health, not only the social, but the social, political, economic, everything that it kind of comes with it. Because as you know that in the past, we only looked to the purely medical outcome, clinical outcome, but now health is a political issue. Health is beyond. That's why when we're looking to people, we're looking to people as whole human beings, not only as a diagnosis, not only as a treatment. So I think the most urgent inequities in North Africa is around access to sexual and reproductive health, because it's not a purely health system an issue. Also, mental health, especially women's mental health, is also something that we pay attention to. So if I give you an example from Morocco, for instance, so Morocco, a study from Morocco discussed that public primary health care providing reproductive health services mainly targeted married women, and unmarried women will rarely access them for consultation, contraception, HIV screening due to a widespread of social stigma. And also my research, like the one that I did in my hometown itself, unpacked that everything that is when it comes to the access was clouded by the misconception and a strong cultural stigma that discourage women from seeking care. And now we need to understand and we need to think about that access isn't just about availability of services, but it's about agency, it's about privacy and social acceptance. So, and then when it comes to the other layer of the socioeconomic and the geographical disparities, so women in rural areas might not get access to proper health care in comparison to women from urban. So, and this adds a lot of barriers and layers. So cost, distance and lack of information. And then you're bringing also the gender norms and the power dynamics within the family itself that shapes the decision making of women. So majority of women, they don't have the power over an agency over their bodies, over when they're going to get pregnant, and if they have the ability for abortion. So more broadly, many health systems are simply not designed around women's realities. Women's realities is excluded. It's only built over partial human reality. And end up being health systems fragmented, less accessible, not inclusive, not sensitive, and always not responsive to certain realities. So these inequities go beyond healthcare. It's deeply rooted in social and structural dynamics.
Sure. I mean, it's very powerful to hear you speak about that because in a sense, you are also then, as you say, you're not just dealing with purely health question, but these broader social political dynamics. I mean, I would imagine, because you're also touching on deep cultural norms, what's been the experience like, you being a woman trying to sort of bring more awareness about these conversations? And has there been any pushback, because you're now challenging cultural norms? And is it like, hey, don't come here and be Western and ask people to be free, What's your experience been on that,
Women now are becoming more aware of their rights in comparison to what they have used to be in the past. Social media is you can access you can access so many information from social media. The world is big and it's like a small village. But the thing is, what kind of information they are accessing it? Is it a falsified? If it's a right information, who's providing this information to what certain extent? I think now conversations are emerging in comparison to how it used to be in the past. It's always going to be a pushback because these ideas and these ideologies are serving certain type of people and certain type of ideas in the community, and it's beyond healthcare and it's beyond. But what I've noticed, there are women now are more open and they really want to seek information and the right information, and they really want to have a healthy sexual and reproductive health, and they want to be happy and they want to have agency. And that's why I'm really glad that this research is coming on the right time, because also the governments themselves are really trying to improve the kind of access, the kind of services, because, even with the rich regions across the continent, still we have maternal mortality. We still have issues about menopause, about menstrual health. So we have conversations, but we need to make sure that these conversations are bringing people who really need this and need help the most. And we are listening to them. We're bringing their voices. We are customizing solutions to address their realities and their needs. And we're not just imposing our own thoughts and our own perspectives. So as I said, there's always going to be a pushback, but women now are more aware. And this is such an amazing thing.
Amazing, amazing, amazing. All right. So let's do a couple of scenarios here. And I'm going to ask you a couple of questions. Short, sharp answers, eh? So please say the first thing that comes to mind on the following. If you had a free day with no responsibilities, what would it look like?
I would start my day with a very nice brunch and a really good cup of coffee or a matcha. I would spend the time outdoors, walking, sitting in nature by the water. I might also visit a museum, a gallery, go for punting in Oxford during the spring and enjoy noticing and appreciating small details. And later I would meet friends maybe for a dinner and enjoy quality time with them.
Nice. Sounds very nice. What small thing brings you joy?
A really good cup of coffee in a calm space, along in a peaceful walk.
All right. And then what could you talk about for hours that might surprise people?
Self-love, self-care, reflecting on my personal journey, how we grow, how we change over time, and how important for people to slow down, to remember that they are humans, and take care of ourselves and create spaces for reflection beyond our daily responsibilities.
Interesting. So, I mean, this is clearly something that matters to you. And I mean, you've spoken a lot about it. How has becoming more grounded shaped your daily life over time? Because I think sometimes we talk about this, we say, self-love, reflection, slowing down, but we also live in this world where sometimes these things start to become popular, everyone's posting hashtag self-care, self-love, etc. But practically, when you think about doing that, how has it really helped you shape and shift your life over time,
It's like coming home to myself. It's like you have been away for so long and you're just coming back home. So I'm enjoying my company more, being present more. So I'm not only physically in the space anymore. I'm present, I'm noticing, I'm observing, I'm being mindful, and I'm becoming more efficient and more compassionate towards people. I put myself more in people's shoes to try to understand where they are coming from, the struggles that they are also grappling with. I'm making more decisions, better decisions. And I am not reflecting now from a place of exhaustion or anxious and anxiety. I'm responding from a place of intention. So perhaps the bigger shift of all is I stopped measuring life by the quantity of things that I am doing and producing, but by the quality of conversations, quality of relationships, quality of impact. And this realization changed everything for me.
Beautiful. Well, I resonate with you a little bit on that. I think your Enneagram, you Enya 7, hey?
I'm a visionary dreamer.
Yes, so we always out there wanting to do everything, 10,000 things, and you sort of, one sense of value being measured in that way. And yeah, I really resonate with that because I've been trying to figure out how do I slow down, but in a way that, as you rightfully said, actually presents you into who you are in this moment with everything that one has to hold, So for me, like as the CEO, as a mom, as a friend, as a daughter, etc., how do I also make sure I can have that me time that grounds me and allows me to be able to show up with quality? And it's also, I don't know, I'm curious for you how it's played out, because it's also meant I've actually had to say no to a lot of things. So those boundaries actually being important, because usually my Enya 7 will say yes to everything, then I overtire myself, and then I'm constantly feeling like I'm disappointing people because I'm not 100%. But actually I've started to realize, well, to have more quality experiences, I actually have to say no to a lot of things. And that's also even been implicated in like friendships and who are the friends I'm spending time with? Are you feeling drained or energized, So I'm curious if you've seen like an impact on your other sort of dynamics around work or socially as you try to seek to have more quality experiences in your life.
I really resonate with you because it happened especially in my social circle. With time, you're always there for everybody, but then you're there for them and you care for them. But then you're asking yourself, is people doing the same for me? Is people are there for me? So I decided, okay, let me just pause a bit and see how people would reach out. And with time, people like, you were traveling, you were busy, but no, even when I'm busy, I can make time for people that it really matters.
Yes.
But are you doing the same for me? I was pouring so much out of me, and now I'm pouring so much into Reem. And now people can respect that. In the beginning, it was a huge shift, because you're always there for them. But now they realizing that this person also matters. And so what I really learned throughout this journey, that I'm listening to my body, and I'm listening to my intuition, and I'm listening also to Reem, and I'm honoring Reem as a human being, as same as I'm honoring everybody around me. And Reem also deserved to be honored, to be loved. Like, I'm sharing love, I'm caring for everybody. So Reem also deserves that love comes back to her as well.
Amen, amen, amen. Absolutely. All right. So speaking about pouring into, you are quite passionate about mentoring young women entering medicine and science. Who helped shape your journey, and what did they give you that you now hope to seek to pass on?
So I was fortunate that I didn't have only one mentor. I had so many mentors. So I was fortunate to have colleagues who supported me during my time in the WHO, the Africa CDC, and the government, and also my professors who were very kind and nice at UWC, at Oxford, who have seen things that I haven't emerged, but I haven't seen in myself. And the kind of belief at that right moment I think it's everything. But one professor in my particular, she was my former supervisor at UWC, Professor Wanga Zembi. She moved me most deeply. She also grew up in a disadvantaged community in South Africa during apartheid. She faced similar barriers to mine, structural, social. And but she also took herself, and she got her master's and doctorate from Oxford. And now she's a senior health systems specialist in the South African Medical Research Council. And quietly, steadily, she inspired me every single day.
Beautiful. So we looking at you being at Oxford now and the PhD that you're doing. You've spoken a lot about building locally rooted solutions. How do we ensure that innovation in African healthcare is not imported and imposed, but grounded in community realities? And what role do you see yourself playing in ensuring that innovation is locally embedded?
So I would like to say that community is not a recipient, it's actually a source. So as we say that innovations, we call innovation, it arrives with funding, with branding, with urgency. It's designed somewhere else for different context. And then we keep wondering why it's not working for us. So I think it starts with a radical listening, not only surveying by outsiders. It's a genuine and sustained presence into the community. I think we should listen to the community health workers, like traditional healers, grandmas in the communities who have been supporting the health for grandchildren for years. And I think the question is whether we are humble enough to receive this knowledge. It means we co-create with the community, and if a solution always needs an external expert to maintain it, we would say that we didn't build a capacity. We would say that we are building dependency. So this is not an innovation. I think it's a form of an old relationship that is still not working for us. So I would like to bring some examples into this. So, for example, in Kenya, there was a local engineer. She developed a Vaki box, which in 2020, which is a solar-powered fridge, small enough for a motorbike to carry vaccine to communities with no electricity. And by 2022, when it was deployed, she won Africa Prize for Engineering Innovation. And one clinic in Kenya reported 150% jump in vaccination. So as you can see, no one commissioned these solutions from elsewhere. It came from listening to the community. And also in Egypt in 2018, Egypt faced the highest rates of hepatitis C. And Egypt refused to come up with, to get the external, treatment. And they decided that they're going to be using a trade law, produce generic treatments, which reduced the cost from $84,000 to less than $100. And around 60 million people were tested and 4 million were treated. And Egypt then in 2023 became the first country in the world to reach the WHO gold tier elimination. And so I would say that the lesson here is we need to invest in sustainable funding and local funding in Africa, led by Africans. And we're investing in young African health innovators through mentorship. And this is what we can come. Mentorship, training, access to resources, and particularly digital health. But we need to make sure we are tailoring these solutions to meet our own realities. So things can work in North Africa might not work in the center or the West, and the vice versa. So we really need to be very mindful of our realities. So as I say, that as a strategy for a continent that cannot afford to keep outsourcing its own solutions. And that's why what I can do is I can bring the knowledge that I've been fortunate to have in Oxford, to bring it back home to the continent where it belongs, and make sure we are tailoring to meet our own needs. And and so it's something that we really need to focus on, especially with the global health. The global health landscape is shifting with different priorities, different agendas, and different funding. And now we really need to think as Africans, what can we do for our own continent?
100%. And I mean, look, you're sitting obviously in one of the top institutions in the world. So I'm quite curious about your experience so far being located in that center of academic power and how Africa is spoken about and perceived in those contexts, and how your response has been. And it doesn't have to be perfect, right? Because it could be like, maybe you're new and you're trying to still find your feet there and you don't want to push back too much, or do you feel like there's space to be able to sort of say, no, there's an alternative way to think about Africa? Yeah, I think particularly in this current global context, how are you navigating that question?
I was fortunate to be part of the Africa Oxford Society, where it's a society where, as I always say to them, it feels like home away from home. Because you feel accepted, you feel listened, you feel valued. And I was fortunate last year to be a mentor in the society, to make sure that we are supporting more students to come and receive the education at Oxford. I was also fortunate to attend debates for Africa done by Africans in the Oxford Union. We're bringing conversations, very in-depth and very controversial conversations into Oxford Union, and you know what it represents historically. And also I was fortunate recently to having conversations with professors in Oxford, to see how can we empower more African students to come to either get their degree from Oxford, doing summer schools, being mentored by African professors. So I always say that even we cannot bring everybody to Oxford, how can we bring Oxford to every single person? And everything is young woman and a man in Africa, to make sure that they are making difference in their own realities, in their own communities. So I always try to, as much as I can, and I'm very proud to be in this society, in these spaces, and bringing these conversations. And I can see that now the narrative now is shifting in Oxford, and people really want to support. And Africa is now taking its real shape, and the real reframing in the spaces was historically, not welcoming.
Mm. And then tell us, your dream in terms of Reem in 5-10 years, having gotten the PhD, and then sort of how you imagine the impact you'd want to make? Are you thinking you want to go back into, working in government or civil society or external consultant or academia? Are you thinking through what that looks like for you going forward?
I want to teach. I want to transfer this knowledge to other young people across, not only in the global north, but also in the global south. And I also want to consult not only in my region, but across the continent. I'm indebted to the continent, and I'm always honored to say that. And I really want to give back. So I think I would keep mentoring formally and informally like I used to, but also I would like to teach and consult to make sure that I am bringing the knowledge and co-creating with people, because people deserve better life and better future for themselves.
All right, Reem. So if a young African leader listening today were to ask you, how do I begin to change a system that feels bigger than me? Are there any simple practices you might invite them to start with?
Yes, I would like to invite them to reach out for potential mentors who can support and guide them during the journey. I would like also to ask them to invest in themselves and to connect with people who share similar mindsets and also can offer support. I would invite them to take one day at a time and to focus on what they can change, what they have in their control, and don't get consumed by the negative of the system. And I would tell them, dare to dream, be comfortable with the unknown, trust yourself, your dreams, your capabilities, especially during the hard times and when your dreams have not yet emerged.
What a beautiful place for us to conclude the conversation. Reem, thank you so much for showing us that transforming health systems is not only about science, but about dignity, courage, and representation. We really are inspired by your pioneering work and your commitment to advancing women in medicine. Thank you for joining us today on the Mandela Rhodes Foundation podcast. Is there any final closing words you have, if there's maybe something you thought we would have touched on that we didn't?
I would like to tell young women in Cairo, in Khartoum, in Nairobi, please, your voices really matters. And please you have the permission to take up the space, and don't let anyone tell you that maybe your dreams does not match your capabilities, because you have what it takes to be who you are. Just believe in yourself.
Well, to our listeners, if this conversation resonated with you, share it with someone who might find it valuable, and join us again soon as we continue exploring what ethical, values-based leadership can look like across Africa and beyond.